Hi, everybody. This week's topic is social connectedness and communication. So again, a very RT/rehab specific topic. Social connectedness and communication are super important to our profession, as well as other therapeutic connections. That therapeutic relationship, enabling patients to have a strong social connection and communication is really the foundation for a healthy person and the overall quality of life for somebody. So we're going to go ahead and dive into that. So as well as physical health, why is it important, do you think, to address social health? So social health is a critical domain of the holistic functioning of we as humans. It influences mental, emotional, and physical health, so it's all encompassing, and it also impacts treatment outcomes and overall quality of life. When we're looking at social connectedness, we are looking at that as a sense of belonging and interpersonal closeness. We look at relationships that provide emotional, instrumental, and informational support, and they are distinct from social support, which is, could be just family or close people in our lives that can be measured as perceived or received. So just social connectedness, that belonging within groups outside of a family unit is very important. In relation to looking at the relevance to recreation therapy, as many of us already know, social isolation is a treatment priority. We especially saw this during COVID and saw that not only were people obviously dying from the illness, but a lot of those in skilled nursing facilities and other types of hospitals where the people are very isolated, or people who were isolated even at home, it really took a pretty severe mental toll. So social isolation and treating that is super important. RT goals are often target friendship, development, group interaction, or reintegration. So again, everything that we're doing is really helping to instill those types of feelings into our clients and empowering them to, feel confident in who they are as quote unquote a new person, whether that's post-injury or otherwise. And it's integral for individuals with IDD, the intellectual and developmental disability, traumatic brain injury, older adults, and veterans. So there's a wide variety of people that social isolation can affect, and also a wide range of treatments that can also help them. So now we're just going to hop into some communication basics here. So what is communication? I feel like we all have a generally pretty good idea of what it is, but it is verbal and nonverbal exchange of information. So it doesn't always have to be said out loud. Our actions and our body movements can also be a form of communication. There's two types. There's the expressive versus receptive communication. And this includes facial expressions, gestures, tone, and listening. Excuse me, y'all. So why communication is assessed in recreation therapy. So it's going to help us to determine the interaction ability. So the ability of your clients to post-discharge integrate into society. It informs group planning and support needs. So your group might vary for those that are at higher risk for social isolation than not. It affects safety, comprehension, and self-expression. So there are some common communication challenges that we may see in different RT or other rehab-related populations. One of those is aphasia, which is, for those who aren't familiar, it's basically you can think of the word in your head. It's really common after patients who have had strokes. You can think of a word, but you can't say it. So it can be incredibly frustrating and difficult to communicate with somebody with aphasia. The words are kind of at the tip of their tongue, so to speak, but they can't get it out. Nonverbal autism, social anxiety, and dementia. There's also cultural and language differences that can pose some challenges. And there's also the use of augmentative and alternative communication style that can also hinder the communication, including things like I might not totally understand the lingo that's going on. I'm not that much older than this generation, but there's some lingo that students your age might talk about that I have no idea what you're talking about. So just some things to keep in mind. So next we're going to talk about assessing social connectedness and communication and some tools that we could use for that. So here's a list of some formal assessments that are used for social functioning. So they are the Social Network Map, a Social Skills Improvement System, the SSIS, Friendship Scale, and the UCLA Loneliness Scale, which is a free and widely used scale, which we did talk about last week. So when we're looking at the social network map, it is a visual representation of the client's social world. So that's their family, friends, peers, coworkers, neighbors, service providers. It's going to reveal density, reciprocity, and quality of relationships who provide emotional, informational, or instrumental support. So some things to consider when we're mapping out the process. Clients are going to physically draw themselves at the center, then place others in concentric circles to indicate closeness. The lines can show frequency or direction of support. For the use in the clinical settings, it's going to highlight the gaps. For example, they might not have peers of a similar age, and strengths, which is they could have a strong extended family. We need to bear in mind cultural sensitivity when implementing this sort of assessment. Its collectivist cultures and an extended family or community elders may carry more weight than peers, avoiding imposing Western assumptions of quote-unquote friendship. We can use this to track change. There can be a pre and post mapping to evaluate the intervention, such as a community-based leisure program, that we can track that change over time to see how that patient has improved after their map. The next one is the Social Skills Improvement System. So it is a norm referenced multi-informant. So assessment, this can be, for example, teacher, parent, and self-assessment. It's intended for children ages 3 to 18. It measures communication, cooperation, responsibility, empathy, engagement, and self-control, plus problem behaviors. There is a research term, multi-rater advantage, which means that we can look at it among several different settings. So it captures different settings. So we can look at home versus school versus a recreation program, which is pretty neat. We can see how things differ for that particular person. There is a scoring nuance. So standard scores and percentile ranks allow comparison to age norms, and that can demonstrate treatment effect sizes. Application of recreation therapy. This is going to help us identify leisure contexts where social deficits surface. So we can look at how leisure contexts like a sports team versus an art group may affect that particular individual or group of individuals you're working with. Some limitations are that it relies on rater perception, which could cause potential bias or a halo effect, and you can supplement this with direct observation. So typically you would be observing your client in the particular setting that you're assessing them for this. Next is the friendship scale. So it is a 6-item self-report measuring the perceived social isolation connectedness for individuals. It is validated for adults and older adults. It focuses on subjective experience. So unlike a network map that really counts those relationships, this tool measures felt loneliness. So it's focusing more on that feeling of loneliness. It's pretty time efficient. It takes approximately 2 to 3 minutes, and it's ideal for screening large groups in community programs or adult day centers. So this would be a super valuable quick assessment to be able to do in an assisted living type program, an adult day program, that sort of thing. The interpretation of the scores. So scores below the cutoff suggest risk for depression or health decline. which would indicate importance for a referral to recreation therapy. We can also talk about that cross-cultural validation. So there could be multiple language versions. You can discuss translation and cultural nuances and how loneliness is expressed. So that's a pretty interesting one. So there's also some functional communication assessments that we can look at. Those include a functional communication profile, the communication matrix, and speech language eval reports, and observation-based community coding. So the first one we're going to look at is the functional communication profile. So in the functional communication profile, the criteria reference, they examine receptive and expressive language. It details pragmatic social skills, speech, fluency, and voice. What this does is it combines structured tasks with naturalistic observation, which can fit well in a recreation setting because you can include a task and then absorb them in that recreation environment. So there is a common goal alignment, which is the results from the AAC, the augmentative alternative communication device selection, or group activity adaptations. So that is something that you can use with those who are nonverbal. The strengths, it's sensitive to small gains in functional context rather than just standardized test performance. And some of the limitations are that it requires a trained examiner. So this is probably something that you might not necessarily use. It would be used by a speech language pathologist or an SLP, but TR professionals can collaborate for data sharing. So this is perhaps one of those times that if you're interested in implementing an assessment like this, a functional communication profile, you could work in tandem with a speech therapist. That would be a perfect co-treatment opportunity. So the communication matrix, this is a hierarchical framework with 7 different levels for individuals with complex communication needs. So this can be from pre-intentional behaviors like crying to early symbolic language. This is particularly useful for children or adults with severe cognitive or sensory impairments, so those with autism or cerebral palsy or any of those conditions. The progress monitoring is going to allow micro-level tracking, so we can look at eye gaze, if they use a communication board, switch activation, if they have some sort of other severe impairment, which is essential for documenting subtle but meaningful growth. Family and team involvement. The parents, teachers, and RT staff can contribute to observations when implementing this assessment in order to obtain kind of a full picture of what they are looking at with the participant participating recreationally. It does have an online platform, which means a free scoring and reporting system facilitates interprofessional sharing, which is super cool. I think anytime that you are able to do something that is known to other professions and you're able to collaborate on it and co-treat is always a win, especially for our field. Speech language eval reports for collaborative use. So they integrate standard test scores. These types of assessments are going to have language samples, look at oral motor assessment and therapy recommendations. These types of assessments provide baseline communication, cognitive, and swallowing information that can help guide the RT in planning activity. Again, you would do this most likely along the side of an SLP who is doing these on a regular basis and consult them if there are any sort of dietary or swallowing or whatever it may be issues for the particular activity that you're going to implement. Some key sections to highlight: background, the history, pragmatic language notes, recommendations, including dietary precautions is big in this one. And really, rec therapy is going to use this to align their recreation goals, which might be group storytelling or community integration, somehow with speech goals to ensure safety in activities involving eating and drinking, all of that. Some ethical considerations to consider, just the confidentiality and consent across all the disciplines when looking at that. And observation-based community coding is the other area we're going to look at. It's a systematic, structured observation of communication and social behaviors in natural environments. So this is particularly useful for us because we can use this in parks and community centers or on group outings. So we can talk about the methodology for this assessment. It's going to be to define operational behaviors. Are they initiating conversation? Are they taking turns? You can use an interval or event recording with coding sheets or digital books, like a tablet or an app. This coding can capture real-world interactions. Again, coding in any capacity is a pretty advanced skill. But again, if something to definitely collaborate with other disciplines on, and it's a really good way to be able to track and measure outcomes that you're looking at, especially in a community setting. So it does require clear coding definitions and observer training. It has inter-rater reliability checks, which are critical. Inter-rater reliability is having multiple people look at how you're coding it and why you're coding it and making sure that everybody agrees. Again, that's a little bit more of a research term, more of a research methods type of situation. But again, something that as you move into the profession and that's something that interests you, I encourage you to try these types of things. So we can look at a quick example related to RT with the observation-based communication coding, and that could be measuring a peer interaction frequency during a community sports league to evaluate the program's success. So something cool to think about and use potentially in especially those community-based or sports settings. And lastly is those informal methods. So there's no strict, protocol for how you're doing them, but again, it's observation of group dynamics. So that's simply observing what's going on within the group. You can have a pen and paper with you if you want, or however that may look. Staff and family interviews, so interviewing the staff who works with that person on a particular basis. If there's somebody new into your program, interviewing their family. Same if they're a new patient, having those family interviews can be important and just as beneficial as some of the more formalized assessments that you might use. You can have different participation checklists, so items that you're looking for engagement within a certain program and how they're interacting, socializing, and engaging with others. And then the last one is self-report. So if the client is able to and willing to, encourage them to self-report about how they're feeling communication-wise. Do they feel engaged? How are they feeling when they're participating in a particular activity as it relates to their communication, functioning, group dynamics, all of that. So that is all for today. Thank you all for following along, and I will talk to you soon.